Hello, dear aquarist, dear goldfish keeper. Today we will talk about a fancy goldfish, the Ryukin, that came in at an importer and was showing bad behavior, mortalities, so that the moment comes that the fish doctor has to check the fish because externally we couldn't observe anything. So we had to use the microscope. And I show you my findings. I show I share you my PowerPoint that will explain what we found, and I will give my suggestions what we can do about it. In this case 309, we will talk about the goldfish Ryukin with tubercles in the organs, or most likely fish tuberculosis. You want to learn more about goldfish and about fish tuberculosis, particularly the new illustrated guide has a lot of details on that, and a lot of diseases on goldfish are discussed. The practical guide is a more condensed, newer book with basic contact necessary to understand the origin of diseases, how to diagnose, and how to treat. The books are available below, where you can order them in the link provided. Here we see those Ryukins. Some are very healthy, looking for food, looking healthy, but some are on the side here, the ones who are slowly coming, sometimes not behaving normally, turning around upside down. I show again the video. In general, they looked okay, but every day there were a few losses. There were a few fish that didn't behave normally, didn't show that healthy behavior looking for food. And that's the first sign of a trouble in your goldfish. And here, well, you take that fish out and you put it in a separate bowl and you look at it clearly, closely, but you don't see any lesions, any big wounds, any ulcers, nothing like that. But the fish was, well, respirating heavily, listless sometimes, but not the typical case that people talk about in Mycobacterium with wounds and ulcers. No, we go inside to check the fish. And we check the gills. That's the first thing we do. And we saw that the gills are in bad condition. Look, the lamellae are all gone here. So that respiratory surface is lacking. Here, other parts of the gills were gone, damaged, not functioning. We took out the organs and we put it on two glass plates. And you could see already black spots, black specks all around in the organs of the fish. Well, and then we start looking, and here we see two slides of the kidney. You see all the tubercles inside the kidney. We see tubercles in the other organs, in the liver, in the spleen. Well, in that case, you can suspect that the fish which are badly suffering, not eating anymore, listless behavior, put them asleep, euthanize them. Some fish might be less infected and less damaged and do better. And you have to check with your supplier, the breeder, or check the contaminated food. Maybe it's the mosquito larvae you have been giving. I have videos on that. Check further in my YouTube channel. Treatments are usually not successful, although some people tried rifampicin, minocycline, kanamycin. I explain it in my books, but the outcome is fairly limited. Meanwhile, you can help this goldfish to build up or restore immunity or become better resistant to this infection. And that's for, we recommend a functional fish food like Dr. Bassleer by Fish Food Fico. My books of fish diseases explain about prevention, diagnosis, and treatment. And my Patreon channel can give you more expert training if you want to learn more about fish diseases. So I hope this video about this goldfish help you to understand what can occur and how a diagnosis with a microscope can help you to understand why the fish are dying. Still, a laboratory can go into detail to find out Mycobacterium and maybe find out what antibiotics can be applied, although the bacteria are inside the tubercles, inside the organs, and very difficult to be reached by an antibiotic. I hope you understand. I have special videos on Mycobacterium. Check in my YouTube channel. Punch in Mycobacterium and you find a lot of videos already produced because Mycobacterium is, well, it's common in our fish industry. Thank you for watching.